Hi, I'm Phil Sauer, Director of the Minimally Invasive Surgery Symposium, otherwise known as MISS, and we are here in Las Vegas celebrating our 16th anniversary. I'm here with my colleagues and co-directors of the bariatric portion, Dr. John Dixon and Dr. Bruce Wolfe. John, this year we have somewhat of a unique topic in summarizing some of the outcomes of the Diabetes Surgery Summit in London, and we brought several of the speakers from that meeting, and we reviewed some of the outcomes. Is this going to be a game changer? These guidelines are going to result from this Diabetes Surgery Summit?
I think so, and I hope so. It's extraordinary data that was presented at the summit. It was a terrific scientific meeting, and the clinical data is now clear. And I think we had that presented by yourself this morning. And it is exciting because the key diabetes organisations around the globe are going to see this data. It's going to be published, and they're already being asked to buy into the data. So I think this is a game changer. I think it should be a game changer, and I think we're at the forefront of that with this meeting. This meeting is always focused on that metabolic aspects of surgery, particularly diabetes surgery.
And one of the things we try to do at MISS is bring information to surgeons. It's very practical. Unfortunately, not every surgeon could make the meeting in London, so we tried to condense that into a package that is understandable and they can use. And this information, we hope, is going to be published in the very near future in Diabetes Care, and which will be disseminated across the globe. This afternoon we have a session about quality, and Bruce is going to be moderating that session. We actually have the president of ASMBS, Raul Rosenthal, who couldn't make the meeting, but he's going to be piped in via video conferencing. So Bruce, can you tell us some of the things that we're going to be focusing on with respect to quality?
Well, certainly quality is a critically important component of organized surgery to assess and confirm quality, and to teach practitioners how to go about improving quality. And the program that we have initiated with the American College of Surgeons is in high gear. We're going to hear what the progress is of the MBSA-QIP program, how it is enhancing quality, and what else can be done to lower complications, as that's really a key to the ongoing and progressive success of metabolic and bariatric surgery.
What is the key metric we're all excited about these days that we're focusing on? Is it complication rates? Is it mortality? Is it readmissions? Is it getting patients out of the hospital sooner? Or is everything important?
Everything is important, but it's also challenging to come up with meaningful parameters to measure that occur often enough to be measurable. So certainly mortality is the most severe and important complication that we see, but it is now so rare, fortunately, that
it's a good thing it's rare, right?
Right, a good thing, but at 1 to most 3 per 1,000, it doesn't occur often enough to lend itself to analyzing processes of care or assessing the overall quality of a program. So we turn to other outcomes, whether it's surgical site infection, certainly length of stay and readmissions are popular to measure, but it's not clear they're as good at measuring real outcomes as are actual complications. Reoperations is a good one to focus on. It too is pretty low in frequency, but more than mortality, so that's another metric that can be assessed. So we'll hear about how the progress with the database is going and what we can do to all benefit from these programs.
Great, and readmission has been one of the key things. I know ASMBS in particular has been trying to focus on that. I think there'll be a discussion this afternoon about the so-called DROP program and the impact of that.
Sure. Readmissions are something that are pretty straightforward to measure, although even that isn't clear with hospitals having holding units in their emergency departments, so even defining what a readmission is difficult. And there's a balance between early discharge and accepting that there will be some that need to be readmitted, as opposed to prolonging the index hospitalization. So how all these strategies play out is complex, and hearing what the leaders have to say about it is useful.
Very good, very good. John, you have for several years kind of organized the sort of basic science aspect, and one of the goals of MIST, I think from the very beginning, is to try to bring some of this real basic science information, to surgeons, to make it meaningful, digestible, and somehow relate to their clinical practice. Some really nice topics this year. Can you maybe talk about some of the topics and how they would relate to a practicing surgeon?
Well, I think the important is to bring the broader aspects of obesity and its problems to the surgeon. Let's look at it. They are treating this disease, and they need to understand this disease. And we had some wonderful talks from Bruce on cancer and its relationship to obesity. We were looking at cognition and obesity and the effects of bariatric surgery on cognitive function. Early days yet, but what we're seeing is exciting. And I spoke about the issues of body mass index not being a good indicator of a mortality risk, and how we may have to consider that body mass index has to be individualized for what is optimal, and to think that perhaps we should be focusing more on younger people with a positive weight trajectory than thinking about surgery in the older folk. So it may not be basic science, but it's bringing the problems and issues of bariatric medicine, bariatric surgery into place, so that we're working and we're understanding what are the important things from a patient's perspective.
Yeah, I was pleased to see, it was nice to see that this so-called basic science section, the surgeons were in their seats. We had a full house, they were very attentive, and they were very interested in hearing about this, this new scientific information that is being brought to MIST. Well, always, as a tradition, we've tried to include basic science, we've also tried to include very practical things. Later on this afternoon, we'll have a video session on how to do it, on complications of surgery. Just let surgeons talk shop, and that seems to always be a popular session, Bruce.
Surgeons are always anxious to be up to date on techniques and evolving procedures. If they're working in a private practice environment where they don't have a regular conversation or exposure with other bariatric surgeons, then they may be concerned other modifications to procedures or techniques that they could learn. So the video sessions are always very popular.
Okay, good. And then we usually have in the past sort of ended the program, the last several sessions, on sort of futuristic, controversial topics. Tomorrow we'll be talking about a topic you brought up, John, and that is with all these sort of new procedures, these malabsorption operations coming out, what are the ethics of these, and you're going to be speaking about that, and we even are bringing in some legal expertise to that. So can you speak to the importance of us including some of these controversial areas?
Oh, I think that this is a meeting where we will tackle any topic, and we'll tackle the hard line. We really have to address this, and we don't see it at other meetings, so we're happy to tackle that. What the issue I'm concerned about is the innovation in surgery. We see new things coming along all the time, and we don't seem to have a plan for regulation. We don't seem to have a plan as to how we should roll something out. We see things following fashion more than perhaps they should. And so I'm very keen that we think about this. We know when IRB's approval is needed for innovative work, but believe me, I think if we do it properly, we will see well-introduced, fantastic innovation, but it'll be done right. And we need to think about that.
That's right, that's right. And surgery is very different than drugs. The FDA doesn't really moderate or oversee surgery like they do drugs. So hopefully meetings like this will help provide some perspective on that particular area. Well, gentlemen, thank you very much. This year I think it's been one of our most successful years in terms of registration. You guys have really put together a phenomenal program, and we look forward to next year's event, which will be announced very soon. So stay tuned, and I guarantee you, with these two guys here, we will promise to put together an outstanding program and bring you the best speakers in the world on these subjects. Thank you for your attention.